I'm saying good morning, good evening, good afternoon to all of you. I want to make my slums and of course mobility. But let me first and foremost say that so far in the Gambia, we have 11 confirmed cases and 1 death. There is no single case in my city, and that's a very good news. But what we did was a massive sensitization and urged the community to take ownership. And we involved the CSOs and the religious leaders to be at the forefront. So this has also helped us a lot. But looking at it in the perspective of women and the economy, let me first say that in the Gambia and in most countries, local governments are the first responders and play a very important role in protecting lives. Here in Banjul, the municipality has made sure that women and children are highly protected, knowing their vulnerability. In the informal sector, let me highlight the housekeepers, or better say the maids. In the Gambia, we have what we call maids. There's housekeepers, and normally they live in houses where they're working. For them, sick means becoming sick means becoming more poorer. They will not get paid, of course, if they are sick because they cannot come to work. And this is simply because the nature of their job don't allow them to work outside the home. So this is obvious that if they are sick, it means automatically that they are kicked out of their job. So other women also are hotel workers and have to lose their jobs simply because hotels are not operating now in the Gambia. Gambia is a tourist center, but during the COVID-19, definitely it has really hit Gambia very badly. When we talk about slums, colleagues here, in Banjul, I have a place that we call Tobacco Road, and is basically can be categorized as a slum. So because of the overcrowding there, women and youth suffered the most, and the risk of them infected is 50% higher. So, but thank God, as I said, even though we have the slums there, because we implemented the policy which says the communities should be take ownership and ask the religious leaders and the CSOs taking lead in this. Even though we have the slums, but we don't have a case in the city. We will all agree that in the slums, the social distancing is impossible, and the poor sanitation is also a factor. But again, before Gambia has a case, we already heard about this. I already heard about the coronavirus when I was in Abu Dhabi. This is where I had this coronavirus. When I didn't see my colleagues from China, then I start asking, what happened, what happened? This is where I understand that there was something called coronavirus. So I came with that from Abu Dhabi to my city, and then we start tightening up our belts. So I called the community straight away, community leaders, the CSOs, the Red Cross, and said, look, this is what I brought from Abu Dhabi, and I am sure very soon we will hear the whole world crying out of this virus. So this is how we started, and we tightened our belts. We did what we were supposed to do. That is the sensitization. And when the WHO declared this as a pandemic, Banjul was already far ahead. So again, when we talk about mobility, everybody knows about the informal mobility in Africa, and Banjul is no exception. But we were able to control the cars by pressing government to at least reduce the prices of fuel, which they did, even though much was not reduced from the prices. But we were able, due to our aggressive sensitization, we came also to have understanding with the drivers to make sure that instead of having 10 in your car now, you will have 5. And that is working absolutely well. In the slums also, we were able to give them tanks through the National Water Agency. We were able to quickly get big tanks of waters to put it in the slums, and basically there are a lot of things that we have done using also the platform of REFELA, where women came out aggressively also to take ownership. So we have involved women, and we also, the REFELA now, we have also another chapter that is the he-she REFELA. This also we have brought it in during the COVID-19 to make sure also we have our partners as men to come in also and help us. So REFELA also, immediately let me also take this opportunity to tell you that REFELA also is doing extremely well in this COVID-19. Women are going out in the markets where, if I talk about women and the economy, of course, the markets will take a center stage in Gambia, because this is where the women are selling their things that they farm, and this is where women are selling goods every day to earn living. So this is where also REFELA has played a very important role, and REFELA has gone viral in the Gambia now, and thank also to COVID-19 that has made REFELA also gone very viral, because they are doing a very good job taking lead in the sensitization. Even though we have the CSOs, we are working hand in glove with them. So far so good in Banjul. We have, as I said, we have 11 confirmed cases in Banjul in Gambia and 1 death, but we didn't have any cases in Banjul. I thank God. And my only problem now and my only worry is post COVID-19. That is in the context of the women and youths, especially when we talk about women in the economy. Thank you very much.